All right, let's keep going. So let's talk about some special considerations, and we're going to go into individual problems and conditions for kids. Opening an airway, the couple of specific things you have to do is with the OPA, we don't rotate it into place for infants, right? It just drops in an anatomical position just like you're seeing. Make sense? Okay, you can still use the nasopharyngeal airway, just make sure that it's a pediatric sized airway. Blair, go ahead.
Why can't we just do that with the OPA on adults?
Because adults, there's too much tongue and too much space. You don't usually get past the tongue. Kids, we're talking about a smaller area. Partial obstructions, if the kid is conscious but not breathing, okay, this will be like 5 or 10 questions on your NREMT, guaranteed, okay? Conscious but non-breathing choking infants, you do 5 back slaps and 5 chest compressions. And you alternate those until either A, the kid goes unresponsive, right, or B, the object comes out.
Like 5 at a time?
Yep, so 5 back slaps, flip them over, do 5 chest compressions, do 5 back slaps, do 5 chest compressions, do 5 back and forth until the object comes out or until they regain or until they go unresponsive.
So that's unconscious.
No, this is conscious. Yep, conscious, non-breathing, right, because of an obstruction. Okay? So if you know they choked on something, they're still conscious but not breathing, this is what you're going to do. Okay? This is basically to take place of the Heimlich maneuver. Okay? You do this, the same rules and regulations when it comes to adults for Heimlich, right? Adults in the Heimlich is responsive but choking adults. Okay? The chest compressions is still lower half of the breastbone, about the nipple line with 2 fingers. Push down 1/3 the depth of their chest. God bless you. We talked about blow-by. If you've got issues, you can push the oxygen tubing through a paper cup. They have stuffed animals that have a spot to put the blow-by oxygen on to kind of help with the whole, fear of it. Whatever you have, utilize it. Can't use the flow-restricted oxygen-powered ventilation device, right? Not that we ever use that anyways, but you can't use it on kids. Blow-by again. Care for shock. The most common causes of shock in kids, okay, these are far more common than the bottom one, right? Dehydration, diarrhea, vomiting, infection, trauma, allergic reactions, poisoning, all before cardiac. Even if you see a test question that wants to know what is most likely the cause of cardiac arrest in kids, even if it has 3 respiratory or 2 cardiac problems and a respiratory problem, and the 4th one says a cardiac abnormality, it's still respiratory. Okay, cardiac abnormalities are so rare, it's never going to be the answer. Okay. Here is a really poor picture of all the words of all the things that cause shock in infants. Okay, nothing changes. Open their airway, control bleeding, give them oxygen, lay them flat, keep them warm, transport as quick as possible. Okay, nothing changes from adults.
So, like, for a test question, if they don't have any, like, respiratory problems, but the only thing
then it's cardiac abnormalities. Yep. So basically, in order of, like, most likely it's respiratory, cardiac abnormalities, and whatever else they can come up with. Protecting against hypothermia, we already talked about this, right? Make sure you cover the body and make sure you cover the head. Pretty easy stuff. So let's talk about specific medical conditions, okay? Again, respiratory is likeliest cause of cardiac arrest in child other than trauma, okay? Trauma is easy because it's still talking about pretty high up on the list of leading cause of death. Respiratory is the other one. Okay, difficulty breathing can always be occurred by just a simple cold, right? So it could just be a stuffy nose or something like that. It could be something as serious as epiglottitis, a little less serious but still kind of a problem is croup. We're going to talk about those. All those things are pretty important. Epiglottitis, we saw a huge decline in with the introduction of vaccinations for that, right? Now, if parents don't vaccinate their children, then those things that were on the decline no longer on the decline, right? It's why we saw the measles outbreak at Disneyland, right? It's why we started to see more cases of epiglottitis, is because they weren't getting vaccinated for it. Upper airway, basically, we're looking at the same problems, right? That's why it's not in red. It's the same stuff as adults, okay? When you're listening, God bless you, when you're listening to lung sounds, I encourage you to take the bell of the stethoscope and put at that sternal notch, right? Listen to the airways of kids. Adults, you can do it just to hear different sounds, but kids, most definitely, okay? Lower airway problems, asthma, pneumonia, respiratory infections are just as common in kids as they are in adults, okay? We don't see things like COPD in kids, okay? Because it's a test question, and somehow someone always answers that. Yeah, seriously. What about secondhand smoke? Oh, yeah, you got so serious, didn't you? Got him. Patient assessment, why is nasal flaring in red? It's one of the signs, and it's unique to kids, right? Retractions, abdominal muscles, stridor, audible wheezes. Audible wheezes means what? Audible wheezes means what? Without a stethoscope, right? You can hear it from the door. Breathing faster than 60 times a minute, that should be a pretty good indication they're having a hard time. Okay, cyanosis, decreased muscle tone, decreased heart rate, poor perfusion, all that stuff is pretty important. So people have a hard time distinguishing in test questions and even in real life between croup and epiglottitis, right? They know what it means. They know there's a difference. That's easy, but it's when it presents with whatever, they have a hard time distinguishing between the two. In a test question, if they put drooling, we're talking about epiglottitis, okay? If they're not drooling and we're talking about like a seal bark cough, that's croup. If you have a test question, which you will on the NREMT, that combines the two and says they have a seal-like bark and they're drooling, it's epiglottitis. If the word drooling is in there, it's epiglottitis. Okay? Now, croup, this is mild fever. Okay? These kids are normally fairly active. They get winded easy, but these kids are not as sick as epiglottitis. These kids want to do the normal stuff. Okay? Difficulty breathing, restlessness, paleness, and cyanosis are all pretty common. Okay? This is what it sounds like. So you hear the bark when they cough. That bark, that's croup. That's what usually scares people. They stop breathing. So what do you think? How do you fix it? What do you think?
I don't know, man. I'm not a doctor. You need to talk to a
No, he doesn't. You can fix this at home.
doctor.
Yeah. What's causing the problem? Dryness, right? So what happens is mom or dad calls because this kid, they start to feel better, so they start running around, and then they start doing that, right? They cough, they get real lethargic, and they want to just lay down because they're having a hard time breathing. Home remedies, right? You can take a kid and stick him in the bathroom, close the door, and turn the shower on, and fill your bathroom full of humidity, and this will go away in 10 minutes, right? The other one we've told parents is, if they're going to stay at home, build a fort over a humidifier and read stories with your kids in the humidified area under a blanket, right? You just want a consolidated area of humidified air. Now, a lot of times this happens in the wintertime. Spokane is perfect. You just take them outside. It's cold, it's moist, it's damp, and that fixes the problem. I've literally had parents who call for this, right, because it scares them. It's understandable. We take them outside from the house door to the back of our ambulance. That goes away. And parents are like, what'd you do? Nothing, right? All it does is fix it. You as an EMT, it's well within your scope of practice. If you wanted to, you could take saline, stick it in a nebulized canister, Hook that nebulizer to 6 liters per minute and give him nebulized saline, and it will fix the problem, right? It's not a drug, right? Nebulized saline is not going to hurt them. There's no indications, contraindications, no dose, no nothing. Put saline in the nebulizer, put it 6 liters per minute, and let them put that in front of their face, and it'll fix the problem. If they're going to stay, they still should go, because if they have an, if they encounter an asthma attack or something, we normally still transport these kids. Every once in a while, if they're real sick with croup, they'll get sent home with either a nebulizer and some albuterol or maybe an antibiotic or something like that. It's pretty rare, though. So this is inspiratory stridor. So this is a kid with croup who's sleeping, and you can hear the difference. That's stridor. And you can see mom, I think it's mom, yeah, mom takes the shirt back, and you can see how hard this kid is trying to take just to take a breath. Right? And this is that belly breathing. See how much work that kid's having? Pretty scary. So epiglottitis, these kids are sicker, okay? We're talking fevers of over about 102, okay? Anything less than 101.5 of a fever is what your body's meant to do. That's not a, we don't call those even a fever until they're above 101.5, okay? 102, 103, 104, these kids are going to be starting to look sicker, okay? That's the big distinguishing factor, is they appear more ill with epiglottitis than croup. 103, 104, just high temps, right? Croup will present with that low-grade fever, right? The 100s, the 101s, mid-101s. We start getting 102, 103. Those kids are kind of losing their battle with fevers, okay? The other one that a lot of parents kind of freak out, if you can control the fever with Tylenol, then you're still doing a good job, right? If Tylenol doesn't touch the fever, that's when you start to get concerned, right? What's the leading cause of seizures in kids? Fevers, right? So make sure you make that connection between fevers and seizures. Okay, the other one is that drooling, right, with epiglottitis. Now, this one is unique. Under no circumstances do you inspect the mouth for any reason, okay? In epiglottitis, if you manage to stimulate anywhere past the tongue, it can cause that epiglottitis to spasm shut, and it will stay there until the kid's dead, right? The epiglottis, it's so swollen and so irritated, when you touch it, it'll just close, right? It actually retracts away from you and spasms close and shuts off your trachea like it does when you drink water, right? And it will cause big, big problems. So for no reason, don't let them put their own hands in their mouth. Don't you be inspecting the mouth for any reason, right? And these kids will want, they're usually like scratching at their tongue almost, right? Because their throat hurts, and so they're sticking their hands in their mouth. Keep their hands away from their mouth. That's probably not going to cause enough, right? In fact, if that'll console them so they don't get agitated, that's what you want. You want to keep those kids as calm as possible. Croup and epiglottitis, you don't want them crying if you can help it, right? The downfall is a crying kid is a breathing kid, but you just don't want them agitated because it can cause some big issues.
What can be done in the field to fix the epiglottis?
Surgical cricothyrotomies. That's it. Yep, paramedics, that's all I got. Very bad day. Patient care for a kid with a fever. Remove their clothing, right? What do mom and dads always do with kids who have temperatures? Wrap them up, right? Because the kid's shivering, because that's the reaction with a fever, right? Mom or dad thinks they're cold, so therefore they wrap them up, which just increases their body temp. I'm not saying like you don't strip them down and just leave them open, but undo the swaddle a little bit and allow them to move their extremities, right? Allow some area that heat can get out. Watch for shivering is still important, okay? You can follow the protocols when it comes to water ice chips, okay? I left this here because if it's there, it means someone has tried this. Do not submerge your pediatrics in cold water. I feel like that's self-explanatory. Do not use rubbing alcohol to cool your patient. You can use other types of alcohol, just not rubbing alcohol, according to this PowerPoint. Transport a patient suffered a seizure, right? Most of the time when kids seize, especially the infants, mom or dad calls for cardiac arrest, right? Because when they see them seize, they're holding their breath, they're turning blue, right? Somehow there's always this disconnect. They never tell us when they're out of seizure and tell 911 they're breathing again, right? So we get dispatched to cardiac arrest for an 8-month-old infant, right? They come out of seizure. It takes us 50 minutes to get there. We walk in the door. What do we think we're walking into? Cardiac arrest, right? So know that seizures have a tendency to present an awful lot like cardiac arrest when it comes to kids. Kids with meningitis, notice how we talk about ABCs, non-rebreather, breathing, and so on. What else are you going to be worried about? What do you think? You getting it, right? Can kids have stuff that you don't want? Yes, just like adults. Now, they might have it because of mom or dad's poor life choices. May not be their fault, but they can still give it to you. So be thinking, those coughing and hacking kids, be thinking still BSI. Patient care for diarrhea and vomiting, the biggest concern there is dehydration. Okay? Patient care for child that's experiencing a seizure, open the airway, just don't put anything in their airway. No different, right? On their side, alert for vomiting, provide oxygen. Same as adults, just remember that it's most likely fever caused. Altered mental status, it's just like adults. Be thinking about MOI, be thinking about shock. Can pediatrics have diabetes? Yeah. What usually happens is they have diabetes and no one knows it yet. Okay, so still check glucoses on kids. Poisoning, number one thing, call poison control. Okay? There are one-pill killers or one-teaspoon killers that are really, really lethal in kids. So any pill that they take or a substance they take, make sure that parent or that you're calling poison control and then giving instructions to parents if needed. Patient care for drowning, we still think about spinal immobilization. The big thing is think about hypothermia, right? Even a kid, we've had those stories, kid falls off the boat, dad makes this, miraculous recovery out of the water. If they've been submerged, they still need to get transported, right? Because you worry about aspiration and aspirated pneumonia. Okay, they still need to go to a hospital. Sudden infant death syndrome, I thought I put it up here. Under no circumstances did these words come out of your mouth on scene. Okay? Define sudden infant death syndrome. How is it diagnosed? So it is a dead kid, but that's not the diagnosis. Nobody knows, right? They have to do autopsies, tests, toxicological things, CTs, everything. It is impossible to diagnose this in the field. Okay? Do not let that word or those letters come out of your mouth. Okay? The only time you don't start CPR is if rigor mortis is already set in. Other than that, you start CPR. Okay? If you're going to pronounce this child dead, you and a paramedic, because you got to have a paramedic anyways, think about now you have more than one patient. Right? There's mom, there's dad, there's family, there's you, there's the other fire. All those people are now involved. Okay? The one term that's being replaced in the medical field is shaken baby syndrome. It's now called traumatic, traumatic head trauma or something like that. It's meant to encompass, or it's meant to be specific and encompass more things, right? But SIDS, we have people that say this or put it in their reports. Doesn't belong there, okay? You responded to an infant who was not breathing, right? We just don't use the term. Interesting, two things. WSU, what was positive WSU? WSU had a group, it was an article that came out from WSU, I think it was a nursing program, had a group that found that there's possibly a link between the internal hairs in the baby's ear that actually doesn't allow the infant to realize that they're laying flat on their back. They don't realize they're not sitting up, they're laying flat. So when they puke or when they have problems breathing, they don't turn their heads to the side. And so they're looking at that could be the reason. So if you could pick up on that, you could then instruct the parent to position their kid, whatever. And, my daughter was born, they told us under no circumstances do you lay them flat on their back, right? 2 years ago, it was under no circumstances do you lay them face down. They go back and forth, right? They tell you to make sure there's no, you would document things like excessive bedding in the crib, lots of stuffed animals, anything. You're still going to document surroundings, but you just kind of point all the fingers and let someone else do that. Mm-hmm. Right. Right.
And a kid a couple years ago came up with like a pacemaker looking thing that goes onto a onesie pocket that detects when the baby stops breathing and it alerts the mom's phone.
Right.
And goes off so they can go and fix it.
Yeah, if the kid, there's been a couple of circumstances. If a kid survives, what was that?
I can barely stick my nose when I graduated high school.
What's changed?
Now I can pick both my noses.
Both of your noses?
Both of my noses.
Yeah, just come here, dude. Now it's 70. Yeah. And don't stop until you're done. If a kid survives an incident like that, they do put them on like a fetal monitor that alerts them if they have a lack of respirations. The other one that's interesting that came out of the article, all the research that WSU nursing did you know there's never a single documented case of SIDS in a third world country? None. Including all the countries that have doctors and nurses and all that, not a single documented case of SIDS in a third world country. Yeah. Super weird. What's that? But they have doctors that leave here and go there. I mean, all those places, and they've never had a case of SIDS. So is it doesn't get documented, or is there something that links the two together? It's kind of crazy. Say again?
What's the likelihood of a child living through this?
SIDS is dead, right? That's what I'm saying. This is dead, right? You don't say they survive SIDS because the only time this is used is when they are dead. Does that make sense? So they might have, like, you could say they suffered respiratory arrest that was unknown cause, but you wouldn't call it SIDS, right? That's the key word. That's why I say we don't use this in the field because there's no way for us to know that that's what this is, right? One of our paramedics had a horrible case of a special needs kid. I think he was 4 or 5, and the caregiver called and said that the kid's not breathing in bed, right? This kid had some seizure disorders and whatever, and so the conversation was we had assumed this kid had died from SIDS, right? Come to find out, it's currently on trial because the caregiver bashed his head against the corner of the dresser and then laid the kid in bed, right? She tried to kill him, right? But the whole time we thought this was a medical problem. So thankfully the paramedic documented all kinds of stuff about what was said and the stories not lining up and injury patterns, and some of the injury patterns take hours to show up. 12 hours later, this kid showed up with battle signs, right? And then it was all these things that started linking together. They finally investigated and found out that this kid had basically been murdered.
So it wasn't noticeable when the paramedic.
Battle signs takes 24 to 48 hours, or 12 to 24 hours, sorry.
Was he dead?
Oh, yeah, the kid was very dead. Yeah, he was seizing. The mom was, or the caregiver, I always say mom, it's not mom. The caregiver was like, the kid's been seizing for 30 minutes. The kid always has seizures, so I just didn't call till now. Well, the kid had been seizing because he had a traumatic brain injury, right? She had hit him in the head at like 1 in the morning, and this was like 9 a.m. So God only knows what's happened in the last 8 hours. So the kids, there were other kids in this house, went to go wake him up and found him, stiff and seizure-like activity in bed. And so that was the original call. It wasn't that long ago. Yeah. He was like 3 or 4. He wasn't very old. Yeah. Wasn't very old. Yeah. Yeah. I don't think Bill would wait. Bill would just go get that person. But it's already in jail, so. Go ahead. What's that? It happens. Like, I will tell you, from a parent, this is every parent's worst nightmare. It's common enough this is your worst nightmare, right? This was the most terrifying thing of having a kid to me. right? After a year, it decreases the chance it will happen. My daughter turned a year, it was like one less thing I got to worry about. It is. Right. It's not. That's why when the caregiver started spouting these terms off, the paramedic was like, something's weird. What's that? What do you mean? Crypta. What is it? Yeah, they might use the two terms interchangeably. That makes sense. I'll look that up. I hadn't heard that before. All right, so let's look at pediatric trauma, right? Sadly, about 5 slides, we start talking about child abuse, okay? So just kind of get prepared for that. During motor vehicle collisions, unrestrained head and neck injuries, restrained, you still got to be concerned about abdominal lower spine, especially if these kids are being pulled out of car seats too soon and placed in the car in a seat they don't belong in, right? We still see that on a pretty regular basis. So unique injury patterns with kids that are struck by vehicles. Kids turn their bodies towards the vehicle, right? Adults have a tendency to turn away and protect their body. Kids actually present their body straight towards the car, right? Which leads to unique injury patterns. Because of their size, it causes them to have head, neck, and chest problems, right? Adults, we tend to have like mid-chest down. Does that make sense? The other one is kids tend to either get struck and thrown or struck and get pulled under. Because they're so small, they end up underneath the car. Adults, we either get struck and thrown or get struck and end up and over. I've tried to look it up. I don't know why. Right? It's just the injury patterns is consistent with them turning towards it for whatever reason. No, this is auto versus pedestrians only. Right? So what, like they're walking in a crosswalk and you come from this way, they'll turn their bodies towards the car. Where we normally turn our bodies away and attempt to soften a blow from the side or from the back. Sick or not sick? Didn't think so. Head, larger, heavier, we talked about that. Chest, this is pretty much all a review. Contents of the thorax. So you kind of look at where this stuff sits. You just think about all the abdominal organs tend to kind of sit out of the protection of the rib cage, okay? But it's a smaller surface area, right? Not a whole lot of room to take an impact with the small chest cavity and abdominal cavity. Okay, pay attention for internal bleeding. You're still going to look for vomiting. You're still going to look for blood. You're still going to look for bruising. All that stuff's still the same. Okay? Organs are all in the same spot. We're just put it in a smaller body. Okay? You can use a KED to immobilize a kid. Okay? They don't recommend it, but if this is all you've got for spinal immobilization, great. I don't know what drug you have to give a 3-year-old to lay like this for a picture, but I'm buying some, right? In a C-collar and laying on a KED. And then you finish the job, and she's still laying there, right? The one thing you run into is these straps aren't going to work, right? You also don't use the leg straps. Yeah, it's just tape. Duct tape works real good. Okay, burns. We know your your rule of 9s. It won't be in the next test, I promise. But know your rule of 9s. Okay. Cover the burn, just like we talked about. Airway is still a big concern. What do we start thinking about with burns? Abuse and neglect. Okay. So here's the not fun part of this PowerPoint. So these are different injury patterns that are consistent with child abuse and neglect. Okay? Biting is still really, really common. Okay? Whipping with cords is also very, very common. Okay? Kids that have been bound or gagged or restrained against their will, you obviously have marks consistent with that. Right? These are the things that you have to pick up on. Say again, Sydney? I don't know how common, but that might be how they restrain a violent kid, right? Autistic kids with parents who are uneducated, maybe that's their form of controlling the kid. Who knows? Yeah. Burns is common. Cigarette burns are common. Slap marks. The stuff with like cords and bites, notice the locations, right? It's because they're hidden from people at school, right? Kids don't see it. It's not accidentally found by a teacher because they're hiding this from other people. Okay? There's the psychological stuff, of course. That's a little bit harder to pick up on. But the neglect, the physical abuse, and the sexual abuse, you really, really got to pick up on. In Washington State, it's a mandatory reporting guideline, right? If you suspect neglect or abuse and you don't report it, and they found out you transport with enough evidence to suspect it, you can be charged. Okay? That was the big thing where 3 weeks ago, I was like, well, here's the deal. If I don't report it, what's the chance of me getting in trouble? A lot, right? So I weighed the, you know what? My biggest concern is those kids. Okay? So, go ahead. How do you mean? Nope. Nothing. That was my very first question, the CPS lady. Was, so if I'm wrong about this, like, what happens? And she's like, nothing. We investigate it. She's like, most parents get offended in the beginning, and at the end when they say, you know, someone called because they were concerned about your kids, their anger gets replaced with, well, at least someone's looking out for my kids. Right? Like, if it happens, it happens. Right? I will tell you for a fact that there was not a doubt in my mind that they were going to find something. Right? It's the subtle little things that you're like, well, you know, the kid told me mommy didn't feed me today. You report that and comes to find out the kid's, you know, lying or there was extenuating circumstances or whatever. No big deal.
With those 3 kids, how long ago was that? Was that recent?
3 weeks.
Oh, you know,
3 weeks? 2 weeks.
It was 2 weeks ago.
2 weeks ago.
You know, they got taken out.
I haven't heard. I didn't get a phone call from a lawyer asking me to be a witness, so I don't know. I will tell you right now, if when they went to that house, that they will pull those kids. I guarantee you.
They just can't hide some of the stuff, like the holes in the wall.
Yeah, I mean it was the worst place I've ever seen.
Yeah, it was.
Yeah, she was on the ship with us.
Oh, like punch holes.
So there was punch holes, but there was holes in the floor. There was holes in cabinets, and some of that stuff was not new. Yeah, it was, like I said, I've been in abandoned houses that were cleaner. Mm-hmm. It was.
Yeah, like they said the door was broken open, but it looked like it wasn't in good shape.
Yeah. Yeah, the cops did forcefully remove the front door. So at least for a month or so, that house was not livable, right? They showed up and heard this guy beating on his girlfriend through the door because she had called 911 and turned her phone upside down, so it was just an open line. One of the Stevens County deputies did a pretty darn good job. The door didn't just come off. The door jamb and all of the mounting came with it. Like, the entire door was gone. Yeah, and it was hanging by, like, a nail. Yeah, it was impressive. Yeah. Think of, you know, always or almost every imaginable kind of injury and maltreatment is possible, right? You're looking at those pictures, that's the tip of the iceberg, right? Dipping, where they dip the kid into boiling water, is still common, right? Biting, cigarette burns, eating horrible foods or stuff, intentional stuff like that. You hear about those child abuse cases that literally just blow your mind, right? Yeah, oh yeah. We've seen kids, or we've heard of kids in the ovens, kids in washer and dryers, all kinds of stuff, right? Not only is this stuff important to know for the kids' sake, but also be prepared to how it's going to affect you, right? It's going to eat away at you, okay? These are your signs of physical abuse, right? Broken bones that aren't consistent with stories. I will tell you, broken bones in infants is not common, okay? I don't care if they fall from a one-story building. Broken bones are not that common, okay? Their bones are very, very, very pliable, okay? Be thinking of any broken bones, be asking about story and history and so on. Blair, go ahead. Yeah, they do. That's where the term came from, right? They bounce. Okay? Head injuries, abdominal injuries, bite marks, burn marks, all these things you ask the story. You match the burn pattern, or you match the injury pattern to the story and determine if it's feasible. Okay? Now, when it comes to bruises, you do not speculate on how long or how healed the bruise is. Does that make sense? You describe just the color. Okay? Now this is a little bit excessive bruising, But let's say this kid fell out of a one-story window, okay? Now that's more of neglect than it is abuse, right? Let's say you're transporting this kid because they're dehydrated, and you check their diaper to see if it's wet, and this is what you see. Now I've got problems, okay? We don't measure these, right? This is probably a child abuse, investigator. She's a nurse, so it probably is investigation of some sort. But you would guesstimate on size, right? It's the size of a dime or the size of a quarter or, roughly 3 inches or whatever. And then you document colors, right? These are yellow. This is purple. These are red. Make sense? And multiple bruises, varying from yellow to purple to red, varying in sizes. Make sure you note locations. Make sure you note if it has any specific pattern, right? If you go back to this, it's in the shape of a cord. It's in the shape of a hand. It looks like someone grabbed them. All those things would be important things to document, okay? There are a couple different religions or belief systems that do things that can cause some damage. Coining is one of them. And it's the practice of taking a coin and rubbing it on the back of a kid that's supposed to draw out the disease or the thing that's hurting the child. It tends to leave what looks like an abrasion or bruise, okay? You would still probably document it and report it. It might come back as not being abuse. The other one is what's called cupping, which is taking like a mason jar in a spot. They usually put it over the organ they think is bothering the child, a liver, something like that, and they put heat on top of the jar, right? So the jar's touching the skin, they put heat on the top, and it draws the skin into the jar and leaves kind of like a purple or red circular mark, right? That might be mistaken for, abuse or neglect. Kind of keep that in mind. Birthmarks is the other one. It'll surprise you of how misleading birthmarks can be, okay? So document them, report them if you feel it's necessary, but know that might be the circumstance where you miscall it, they get investigated, and the investigator's like, you know what? It's a religious practice. We found that there's no danger to the child. Thank you for the info. Go ahead, boy.
So if you documented something that you didn't think it was like abuse, but later on they found out that it was, so you had no reason to believe that.
If you documented it, you should report it.
But say it was, you thought it was like a birthmark or something that was actually bruised.
Always err on the side of caution. Make sense? This is a cord whip injury, okay, which obviously we know can cause some pretty severe damage. Possible indications of the adult being the abuser. Inappropriate concern about the child. Either lack thereof or over, okay? You notice they have trouble controlling their own anger. They seem like they are at their wit's end. This is all the caregiver, not the child. Appears to be severely depressed, indications of alcohol or drug use, suicidal thoughts. This is if you're just picking up on things they're saying. We're not questioning the caregiver about this kind of stuff. We're questioning them about, food intake, water intake, baths, daily routine, that kind of stuff. Okay? Preserve as much evidence as possible. Right? Take clothing with you. Give nothing to them by mouth. Don't wash the child or change clothes. If you're going to change a diaper, take the diaper with you. Okay? All those things are going to be important when it comes to investigation.
What would you use? Change it, throw it in a bio bag?
Yeah, bio bag, take it with you. That works. Gather as much information from the adults without expression of disbelief or judgment. Okay? As much as you want to punch them in the face, you have to find a way to keep a poker face. Okay? You don't say anything. You don't judge them out loud. You don't try to hurt them. You don't do anything. You just hope they do something to try to hurt you, so then you can act accordingly. Reasonable force necessary. There you go. Use the things Jay talked about. Right? That's a real good circumstance to do so.
Let me check your pulse. All the way to the floor.
When you're documenting or even talking to hospital, I wasn't so good at this. You still use terms like suspected and possible. I point blank told the nurse, I'm calling CPS. Right? I was pretty upfront. I described the house, And he even said, the nurse even said, do you want us to call or are you going to do it? And I said, I was there, I'll call. If you feel like you need to call as well, that's fine, but I'm for sure calling. And then I texted the guy that was on the fire department with us, who happened to be my boss, and say, I feel like a horrible person, but anything else or anything about that make you kind of concerned? And he said, I'm already making the phone call. I said, great, so am I, right? Just to make sure we were all on the same page. I hadn't had the number, right? I literally just Googled CPS, and there is an office and division here in Spokane, so it was a local number. Okay, the lady was awesome. I started the conversation off, introduced myself. Obviously, my name is Sean. I'm with the Deer Park Ambulance. I don't know how this works, so if I sound unintelligent, I'm really, really sorry. And she just said, just start talking. So I start to finish, why we were there, what we saw, everything. She asked clarifying questions. The whole process took probably about 45 minutes on the phone. And then she's like, what's your contact information, all that kind of stuff, and that was the end of the conversation. And I didn't want to listen, like, okay, so, like, what happens now? And she was like, well, if it goes to court, if you're the first person that calls, then you will be labeled as a witness. She goes, that's really the only reason why you'll hear from us. If it's found to be not a viable complaint, you won't hear from us. If it's found to be that they go to court, they lose their kids, and you never have to be involved, you'll never hear from us. So, that's kind of the downfall is you make one phone call, and the only news you're going to hear is if you got to go to court. That's it. Not what they found, what their thoughts were, no feedback, no nothing.
Can you opt for that?
They didn't have the option. Sydney, go ahead.
Even if you never hear about it or you never go to court or anything, do they have the ability to tell who called?
I don't know. I didn't ask that question.
I can't imagine like an aunt calling.
Good luck.
Have a trusted mom.
Got to make it in the house. What's that?
I can't imagine like an aunt calling with the trust of a mom and then.
Right. I would assume it probably remains anonymous for the most part. It probably won't. Yeah. It probably won't be hard to tell who called, since the only people that were in the house were cops, firefighters, us in the ambulance, and her mom, right? My biggest frustration was her mom, I know for a fact, had been there before. So she clearly thought that was fine. So, it probably wouldn't be hard to narrow it down. And if she wanted to show up at my place of work and ask me why I called, I would give her very, very good examples of why I did, right? Yeah, unlikely. You didn't call 911, I don't have to be nice to you anymore. You show up at my place of work, I'll tell you exactly what I think of you. Right? Like, I honestly, like, after talking to the lady, I felt pretty relieved, but, I still, Gary, last couple of days was like, you still doing okay? Because I've never seen anything like that. It was, like I said, it was the worst house I've ever been in. And I've been in places with human feces, animal feces, this didn't even compare. Right? It was by far the most disgusting place I've ever been in. No. I'm just kidding.
I've been in a CPS courtroom before. Well, not for anything involving me.
Right.
But, yeah, they don't say that, they'll say who called.
Right.
It'll be like, they said like the EMT provides, they'll say like the EMT, they won't say names or anything, but they'll say who called, what agency, and they'll say everything that was said and every piece of care that you gave. They'll read your report in front of them.
Good thing we did good reports. Yeah, that report was probably, I must have spent an hour to an hour and a half, right? And I'm pretty quick with reports, but it was, and that was the downfall, was I'm writing a report about a domestic violence case that I know is going to get linked to a CPS case. So it's like I've got the legal side of it, she goes to court to fight against his boyfriend. I gotta put all that stuff in there, right? Her injuries and her story, and then on top of that, try to paint this picture of abuse or of neglect, and try, the conditions, the door, the food, the stains, the TV, what it looked like lack of food, the garbage that was spilling out of the garbage can into the kitchen, and it was just like trying to paint two very different pictures all at the same time. It took a long time.
Did you just write one report?
Yeah, because there's no separate run number. So it was, most of the neglect side was in the history, because that's where I put, conditions and how you find people, whatever, and then everything else would be linked to the domestic violence side. And I did put in my report that CPS was contacted. That way it's there. That was a question we had. The downfall is it goes on your personal phone, right? Which means now your personal phone is evidence, which means everything that's on your phone, they can go through. So, that's kind of a gray area, right? I would assume, knowing the law enforcement guys, that I will bet you that law enforcement called as well, right? I would be shocked if they didn't get 4 separate phone calls. Housekeeping? Question? I saw a hand. Someone, go ahead, Libby, go ahead.
The thing, I mean, I mentioned it before, but I think you also get away with using like your laptops and stuff like that.
You can. Like I said, we don't have that ability. Like, our laptops don't take pictures. We used to have rig phones. That would probably be a really good example if you had to. With the use of iPads and stuff, if there would have been a cop in the room with us, I probably would have asked, hey, here's the deal. Pulled him aside and like, hey, here's the deal. I'm calling CPS. Can I take pictures? Or asking if he wants to take pictures or whatever. But we didn't have any law enforcement there. They were outside with the boyfriend. Yeah, and there was a cop that wrecked his car on the way or something. So they were real busy. So we just didn't have any access to them.
Well, if you would have scored a couple more points on the fire exam, you would have wrecked a fire truck in the city.
Is it ever common for cops to call CPS?
I would assume. I've never heard of it, but I'm sure. Right? Like, that circumstance, I can't think of anyone that would have walked into the house that would, like, the very first thought would not have been, I can't believe there's kids living in here. It wasn't Travis. Because when I looked at the door initially, I was like, where's Travis? But it wasn't Travis. Yeah, it was bad. So did I. Yeah, I thought for sure that it was something that wasn't livable. I mean, I'll bet you CPS shows up and that place is deemed unlivable. Like, it's a trailer that I would honestly, God, say, you move whatever you want out of it and then burn it to the ground. I mean, it was horrible. What's that? I didn't notice anything. Like, it smelled dirty, but it didn't smell anything other than that.
Did you have like really close neighbors?
Yeah, they were kind of, it's a single wide trailer in like a pretty dark lot. She had mentioned neighbors had called at some point when he had beaten her in the past, so they can't be that far away. But it would have been easy to hear with holes in the walls and the floor and no door and windows open. I mean, is horrible. Yeah. Nope, got rid of most of the sound barriers. Yeah. EMT and pediatric emergencies, so we've basically been talking about this, right? So even if they're non-critical, kids can still take a pretty big psychiatric toll on you, right? So be aware of that. And then, of course, the serious ones can also cause issues, right? Whether or not you have to tell a parent that the child's dead, or you're around it, or you're involved in it, or whatever, it's gonna provide a pretty big toll on you, okay? Don't forget our talk about PTSD and all that stuff that we had way back, week 1. All that stuff is still very important throughout this class. Blair, go ahead.
So, as like an EMT, if you will, like only an EMT-based system, wouldn't you still transport them to the hospital because like you wouldn't EMT?
Can't pronounce them dead.
Yeah.
Yep, you're going.
Wouldn't you just like pretend they were kind of alive until they got?
You don't pretend. Your protocol say you can't pronounce them dead, so you have to transport them either way.
And you have to transport them with resuscitated efforts.
Correct. You would provide CPR. Unless you could, you called MedStar or a helicopter service that existed or, whatever, to get ALS there. I know, like, Enchilium, they don't have paramedics, and if a helicopter service can't fly, they never get paramedics. And so they actually transport. There's a Indian Health Services clinic on the reservation, because that's where the ambulance is. They take the patient there, or they've had cases where the doctor has come POV out of the clinic to come pronounce people in the field. So, I mean, there's systems in place for those type of systems. Yeah, I mean, that's a long time. Dealing with stress, obviously, communication is huge. Talk with EMTs, talk with counselors, talk with your critical incident stress debrief people. Just don't let this stuff eat away at you. Suicide, again, even since we talked, I was going to look it up tonight and I spaced it. Ever since we talked on suicides back in the first, week of class, I think there's been 6 in EMS throughout the country. So 6 in 3 months. It's still a big, big problem.
My buddy did a presentation on PTSD in the fire service, and it's a staggering amount.
At one point last year, they had said that EMS has more PTSD than the military.
Yeah, it was like something like 37%.
Yeah. Yeah, it's astronomical. Go ahead and take a quick break.